What do I think big data is? So I suppose it's the collection of large amounts of data, and as you say, more than your own institution can handle. And I see that there are clearly enormous benefits from that, and I think particularly we should be in a very good position in the UK with 62 million people looked after in that same healthcare system to use this for research and also to improve patient care and the quality of care in the UK.
My definition of big data, I think my first definition is usually one similar to yours, which is, any data bigger than you're used to dealing with is big data to you, so that's key. For a while we said it's anything you can't fit on an Excel spreadsheet, but then Microsoft made Excel spreadsheets, so suddenly take millions of rows, which they didn't before, so we had to change that. In reality, when I think of big data and I think of it's really what it can do. And I think back to this very classic paper that was written by some of the data scientists at Google that talked about the unreasonable effectiveness of data. And it was based on an earlier article by Euan Weigler that talked about the unreasonable effectiveness of mathematics. And what it basically came down to is that once you get to data that's large enough size, you can start to pick up patterns. Their example was one about the leap forward in our ability to do voice recognition and to do natural language parsing of audio. And so I think it's when you can move to the next step in terms of unsupervised analysis, being able to pull patterns out of the data itself, that's when I think you're really in a big data world.
If I had to define big data, I think it's everything that everyone has said, and in a sense it's any data related to the health and well-being of people. And so it certainly pertains to data about our bodies, but it also pertains to data about the environment in which we live. We know, for example, that childhood asthma in many communities previously plagued with a lot of air pollution, that the incidence of childhood asthma decreases when the air cleans up. So that's data related to health. The cause of asthma in those children is clearly environmentally related. Therefore, the data about the environment is pertinent to understanding disease and ultimately to treating disease. And I think that's both a challenge and an opportunity for data science, and that is how to bring in the data pertaining to the health of individuals and populations, and then derive information from those data in ways that can lead to improvement of health of individuals in society and also of the care that's delivered to individuals in society.